Myself is Swadeeshwaran. I am Assistant Professor, Department of Renal Dialysis Technology, Yenepoya School of Allied Health Science. Here I am going to deal about the topic on renal stones. So, the specific learning objectives of renal stones. At the end of the session, the audience will be able to understand the renal stone, they understand the different types of renal stone, knowledge on signs and symptoms, clinical presentation, morphology of renal stones, understand the evaluation and management of renal stones. So, what is meant by renal stones? So, another name of renal stones is nephrolithiasis or renal calculi or urolithiasis. So, by the name itself is saying renal stones, the stones can occur in any part of the urinary tract. So, renal stones is most common in the industrialized nations with the annual incidence of 1 in 1,000 persons and a lifetime risk for forming stones approximately 5% in women and 13% in men. So, the men are more prone to the renal stones. And the factors determining the renal stones include age, sex, race, and geographical disturbances. Then, the most incidence peak will be seen on third and fourth decades. In male, approximately 70 years, and in female, approximately 60 years. And men are more prone to the stone formation than women. Outbreaks of kidney stone can occur as a result of dietary supplements and also some medications. So, kidney stones are associated with, whenever the kidney stones are forming, it is associated with chronic kidney disease, cardiovascular disease, and bone diseases will be there. Then, how the kidney stone is forming? So, reduce urine volume or increase excretion of substances that cause stones such as calcium oxalate, uric acid, cystine, and xanthine or phosphate, which are linked together to form to the development of stones. Calculi may be caused by low urinary citrate levels or excessive urinary acidity. So this is how the renal stones will look like. It will occur in any part of the urinary system like urethra, stone, bladder, kidney, anywhere it will occur. So the signs and symptoms of urolithiasis or nephrolithiasis. So the patients with nephrolithiasis often present with hematuria, which is blood in the urine, as 85% of patients demonstrate at least a microscopic hematuria on urine analysis. So the patients with stone disease will also present with acute or severe flank pain, which will often eradicate to abdomen and other parts of the body like testicles or groin. Then patients will present with fever and chills if they are having a systematic sepsis infection. Then this is how the person was like keeping his hand on the back. This is how the severe pain will occur on the flank region. Then it will spread to all over the area. So the risk factors of renal stones: bone diseases, family history of renal kidney stones, hyperparathyroidism, gastrointestinal diseases, diet factory and dehydration, renal tubular disorder, and urinary tract infections are the most common risk factors for renal stones. Then types of stones. There are different types of stones are available. One is calcium stones, second one is struvite stone, third one is uric acid stone, fourth one is cystine stone, fifth one is xanthine stone, and sixth one is silicate stones. So coming to the calcium stone. So calcium stone is like most abundant stone which we can see. It is like 70% of stones are formed in the calcium stones are only. Most calcium stones are composed of calcium oxalate either alone or in a combination with calcium phosphate or uric acid. So most calcium stones do not exceed the size of 1 to 2 cm in width. Surgical intervention will be required if the stones are greater than 5 mm. Then how the stone is forming, the causes of formation. So there are like stones like previously discussed. Pure calcium oxalate stones will occur in 50%, calcium phosphate stones will occur in 5%, and the mixture of calcium oxalate and calcium phosphate stones are most abundantly occurs in 45%. So the causes of calcium stones are hypercalciuria, which is increased excretion of calcium in the urine, hyperuricosuria, which is increased excretion of uric acid in the urine, hyperoxaluria, which is increased excretion of oxalic acid in the urine. About 50% of patients with calcium stones have idiopathic hypercalciuria without hypercalcemia. So this is how the calcium stones will looks like. So the calcium stones, like how it is forming is, it will goes and line in the tubular with precipitation in the center, which is noticed in the center, and around the centers all other calcium crystals will come and accumulate and forms a sharp edges which causes more pain to the patients. And 10% of cases are associated with hypercalcemia and hypercalciuria, most commonly due to hyperparathyroidism or defect in the bowel. About 15% of patients with calcium stones are hyperuricosuria with a normal blood uric acid level and without any abnormality of calcium metabolism. The most common type of kidney stones, calcium oxalate, form primarily due to the imbalances between calcium and oxalate levels in the body. And coming to the morphology of calcium stones are usually small, ovoid, odd, and granular rough surfaces will be present. It seems to be too dark because of the old blood pigmentation and deposition. Then calcium stones, how it is forming? If it is forms when the urinary pH becomes lower than the 7.2. Then calcium phosphate stones tends to form in more alkaline urine, pH greater than 7.2. Then uric acid stone. Coming to the uric acid stone, this is the only stone which occurs in the acid formation, which is having a pH lesser than 5.5. The acid is the most common composition of bladder stones and is typically radionuclear, which we will find difficulty to find in under the imaging techniques. So this is the only kidney stone that can be reasonably expected to dissolve if we elevated or maintain the pH of the urinary pH. Then this is how the uric acid stones will looks like. Most of the uric acid stones are more acidic. When it becomes more acidic, the solubility of uric acid stone in urine decreases and precipitation of uric acid crystals increases, favoring the formation of uric acid stones. So the stones will looks like yellow, orange, reddish or brown depending on the amount of blood derived pigment that may have formed. And Stewart stones. About 15% of urinary calculi are composed of magnesium, ammonium, calcium, phosphate, commonly refers to as Stewart stone. The other name of Stewart stones is like triple phosphate stone due to the chemical composition. Then since Stewart stones are often contains a mixture of minerals, it is also called as mixed stones. So this is how the Stewart stones will looks like. The stone will have a formation of stag-on, like which is a stag-on. The formation will be there. So it is too big and it will also penetrate more than one calculi in the kidney, and which is composed of struvite. So it is formed due to urease produced bacteria in the urine. So etiology and pathogenesis of Stewart stones, the urinary bacteria which breaks down the urea to ammonium and the carboxyl group. When the urine becomes alkaline, urinary phosphate becomes insoluble and forms a solid phase with magnesium, calcium and ammonium. Women are more prone than men because of the urinary tract infections for the Stewart stones. So an alkaline urine culture of urease producing bacteria and large stones suggests a diagnosis of Stewart stones, and urea plasma urea reticulum test should be considered if there is any strong suspicion of Stewart stone but no organisms are found. So Stewart stones are generally in yellow, white or grey color, and they tend to be soft and friable and irregular in shape. And coming up to the next one is cystine stone. So cystine stone compresses less than 2% of urinary calculi, and the rare type of renal stones that form too much of cystine build up in the urine. So how it is forming? It is associated with, first of all, the cystine stones is associated with cystinuria, which is a genetic disorder or defect in the transport of ammonia acid and cystine across the cell membrane. So the cystine stones are small, round and often multiply. They are yellowish and waxy color. The stones are not calcified but resistant to shock wave. Therefore, laser lithotherapy is usually the preferred treatment for the cystine stones. Coming up to next is xanthine stones. Xanthine stones is infrequent type of renal stone formation caused by xanthine urea, which is excession of xanthine in the urea. So a rare hereditary disorder it is. So an affected patient has a deficiency of xanthine oxide resulting in hyperuricemia and hyperuricosuriia, which is lesser amount of uric acid in the blood, which is lesser than 2 gram per dl, and hyperuricosuriia means excretion of lesser amount of excretion of uric acid in the urine. Patient present with the urinary tract infection, hematuria, renal ganglia and acute renal failure. So there are two types of xanthine stones. Type 1 is caused by the mutation of XTX and X4 genes leading to a deficiency of xanthine oxidase. Then type 2 is caused by the mutation in myelobedonum cofactor sulfurous gene MOCOS leading to the defects of xanthine dehydrogenase oxidase and adenylyl oxidase. So xanthine is a purine, so a compound which useful in the breakdown of nucleic acid. So the accumulation of xanthine or hypoxanthine in the kidneys can lead to the formation of xanthine stones. So this is how the xanthine stones will looks like. And the silicate stones, the urinary silicate calculi or stones are very rare in human, representing only 0.1% to 0.2%. Long-term intake of magnesium trisilicate as an antacid for peptic ulcer disease, which is one of the causes of silicate stones. Then urinary silicate stones are common in herbivorous animals such as like cattle and bovines are very commonly seen, but it is too rare in human. Because of that, incidence rate is only 0.2% for all urinary calculi. So few studies have shown that infants are affected with the silicate stones, which is due to the intake of milk powder which contains the magnesium trisilicate. And how the stone can be reduced? The discontinuation of the use of silicate will help in the reduction of silicate renal stones. and its sizes vary from 2 millimeter to 3 centimeter and weighs around 3.6 grams. So this is how the silicate stones will looks like. Then evaluation, how we can going to evaluate. First of all, the evaluation is based on urine analysis. So whenever we are going to do a urine analysis, we need to find out the hematuria, which is like to be seen most commonly in every urine analysis who are patients who are affected with renal stones. So urine analysis should be obtained on every patient with suspected kidney stone. Urine pH is generally high in patients with 2-white and calcium phosphate stones, but in low in patients with uric acid and calcium oxalate stones. So, and next test is like blood test. It's the basic evaluation of all the serum electrolytes: sodium, potassium, chloride, magnesium, bicarbonate, creatinine, calcium, phosphorus and uric acid can be seen, and their levels are need to be checked for the evaluation. Then ultrasound. So some imaging techniques can be done to find out the stones occurrence in the body. So ultrasound can be identify uric acid stones and other non-calculate renal stones. If they are large enough, like usually greater than 4 millimeter, but it can also miss the presence of the stones which is lesser than 5 millimeter in size and cannot easily identify urethral stones. This is what a stones, this is what computer CT scan of kidney stones. And a non-contrast abdominal and pelvic computed tomography. CT scan is considered as a gold standard as it is the most sensitive and reliable test to diagnose urolithiasis. So treatment. First treatment needs to be given to the patient is to reduce the pain. So the drug which is most commonly is non-steroidal anti-inflammatory drugs medication can be administered to the patient to relieve of the pain. So medical explosion therapy, which is not using any surgical, by the use of medications we can helps in the passing of renal stones which is lesser than or greater than lesser than 5 millimeter. And extracorporeal shock wave lithotherapy is a less invasive therapy, but maybe need to repeat it for larger order stones and it not preferred for the stones which is greater than 2.5 centimeter. So this is how the shock wave lithotherapy will be done. So the patient will be kept in the position of supine position, and the kidney stones area will be identified, and by using a sound waves it will help in the dissection of the stones, or dissection of the stones will be done. So this is what urethroscopy with lateral ureteroscopy. It is a method which is preferred for only lower urethra stones which is especially in the lower urethra. And how it is done, the stethoscope of thing will be sent into the lower part and it will help in the removal or dissection of the kidney stones which is available. And percutaneous nephrolectomy is used for the stones which is greater than 2.5 centimeter, and it is used to remove the stones without breaking the stones. And another prevention method is diet factory, or another treatment method is diet factory. So diet factory is like used when patients should be instructed to limit the sodium intake to 2 gram. Dietary salt restrictions is associated with decreased urine calcium excretion. The result of increased animal protein intake is an increase in the urinary calcium excretion, encouraged to consume a moderate protein intake only for the patients who are available with kidney stones. So several studies have demonstrated a decrease in some incidents when people consume diets adequate in calcium and intake of calcium food from the dietary products. So citrus fruits are used in the prevent of stone formation, like lime and orange fruits are recommended for the patients. And high oxalate food, high pyruvate fruits and high sodium foods, high doses of vitamin C supplements are the foods which need to be avoided for the patients who are affected with kidney stones. Then the summary of the renal stones is, the renal stones are a common condition with high prevalence in men, often linked to factors like age, diet and systemic condition. The types include calcium, uric acid, steroid, cystine and rare stones like xanthine and silicate stones. Diagnosis involves urine analysis, blood tests and imaging, with non-contrast CT being the gold standard. The management for the stones is usually includes with pain relief, medical explosion, shock, lithotherapy and surgery for the larger stones. Dietary modification can help prevent the recurrence of the kidney stones for the patients. So these are my references, and thank you.